Those of us who have had chicken pox or who have been vaccinated against chicken pox, are we immune or at least protected?
I wish, but no, no. If you've had chicken pox, you are not protected. If you have had smallpox, not smallpox the disease, that's been eradicated, but if you had the smallpox vaccine, which many people in the military have had, then we believe you have some protection, and it's believed to be approximately 85% effective. But no, John, the chicken pox can't help you with this one.
So for more on the monkeypox outbreak and what it means for the U.S. public, let's bring in Dr. Frita Fisher, certified in pediatrics, nephrology, and internal medicine. Thanks, Dr. Frita, for joining us tonight. How worried should we be? It really boils down to that.
Well, we most definitely should be concerned, John, because monkeypox at one point was just endemic in Western and Central African countries. It was mostly from animal to human. But the fact that it has now spread so much worldwide, we know that there's human-to-human transmission, and the rate of increase is quite rapid. So we should be concerned. We should still not panic, because I do not believe it will be the next pandemic in the way that COVID-19 is, because to our knowledge, it's not as transmissible. It's through large respiratory droplets as opposed to these tiny aerosolized droplets. Also, it requires a lot of close contact, skin to skin. So we should for sure be concerned, but it is something that is potentially containable.
Those of us who have had chicken pox or who have been vaccinated against chicken pox, are we immune or at least protected?
I wish, but no, no. If you've had chicken pox, you are not protected. If you have had smallpox, not smallpox the disease, that's been eradicated, but if you had the smallpox vaccine, which many people in the military have had, then we believe you have some protection, and it's believed to be approximately 85% effective. But no, John, the chicken pox can't help you with this one.
Okay, so the World Health Organization is calling this a global emergency. A lot of critics say the World Health Organization did not exactly distinguish itself with how it handled the COVID-19 outbreak out of China. Any thoughts on that? I mean, do we need to take them seriously over this particular emergency declaration?
Well, we absolutely need to take them seriously, because as you see, we have already gone to almost 17,000 cases globally. And right here in the United States, we're at almost 2,900 cases, and it's still spreading. And even though we see that a certain community, men having sex with men, right now, the epidemiology shows us that they have the most cases. By no means is this a limited disease to one community. Anyone can get it. Skin-to-skin contact, respiratory droplets. But we should take it seriously. But the only good thing about monkeypox as compared to COVID-19 is that we already have vaccines. We already have potential treatments. And so we're starting out a little bit ahead of the game than we were when the World Health Organization had to deal with a brand new virus of COVID-19.
Meantime, the president is dealing with his COVID-19 positive diagnosis. Dr. Fauci was the head of the National Institutes of Health. Told our Neil Cavuto how he's doing. Listen.
The president is doing really quite well. He continues to improve. He's on Paxlovid. This is his second day now on Paxlovid. He's tolerating it well, and he continues to improve.
He's 79 years old. That's always a danger zone for COVID-19 patients, even among those who've had the vaccines. Is it not, doctor?
It can be, but certainly if you've had both vaccines, messenger RNA, and you've had both boosters, which the president has had, it puts you at a great protection against getting severely ill. We know that Dr. Fauci, who's 80 years old, had COVID-19, and now he has recovered. Also, if you have a baseline health that's pretty decent, certainly the president is not living with obesity, and he doesn't have any major health issues of which I'm aware. So certainly, yes, being elderly is going to put you at risk. But having those vaccines and the Paxlovid, which is an excellent antiviral treatment, will help him, and he can very likely do very well.
This latest strain of the COVID virus has a lot of people saying, okay, we're going to have to mask up again. We're going to have mask mandates. And in fact, some places, some school systems in LA, for instance, are now mandating masks for school kids again. Do you see that coming as a result of this latest iteration?
It's highly possible. And if so, it would be appropriate given how the cases are up and we're already back at over 400 deaths a day. The cases are up. BA5 is very transmissible. In my work as a board-certified nephrologist and hypertension specialist, I'm seeing more and more cases of BA5. Thankfully, right now, most of them are not as severe, but some of my patients, some immunocompromised patients still die. And so, yes, if the mask mandates come back, if we do indeed see that transmission is high, which it is, it will be appropriate. And one thing to remember, John, even with these high cases we're seeing, in some cases 150,000 cases a day, that's an underestimation because so many people are doing home testing and not reporting it. So we may have up as high as 7 times that amount. And so the transmission is high, it's here, and it would be appropriate if all over we have high transmission to use that mitigation factor of a mask mandate. We know that it works.
Dr. Frita Fisher. Dr. Fisher, thanks very much.